Welcome to the first step in your food immunotherapy journey. We're so glad you're here. At Modena Allergy Asthma, we strive to help each patient reach their individualized food immunotherapy goals. In this video, we'll review the basics of food immunotherapy. Food immunotherapy refers to giving an allergic person an increasing amount of the allergen with the goal of increasing the threshold that triggers a reaction. This is called a desensitization. While OIT is not always a cure, undergoing OIT can lead to protection against accidental ingestion of the allergen and possibly free eating. There are two types of food immunotherapy that we offer at Modena Allergy and Asthma: oral immunotherapy, or OIT, and sublingual immunotherapy, or OIT-s. We'll start with oral immunotherapy, or OIT. The oral immunotherapy process starts with ingesting a very low dose of protein from the allergen. This protein is often prepared in a liquid solution or powder. This is provided by the clinic. Eventually, with OIT, the patient will be able to start eating small amounts of the food itself as their daily dose. With OIT, many patients will reach a goal of bite protection. This means that they have a much lower risk of reaction if they accidentally eat the food that they are allergic to. For some patients, a goal of free eating may be appropriate. Free eating means consuming the allergenic food whenever they want with the minimal risk of reaction. Now we move on to sublingual immunotherapy, or OIT-s. Sublingual immunotherapy, similar to OIT, involves slow increases in the food protein that the patient will take daily. However, this food protein is dissolved in a small amount of liquid and held under the tongue for 2 minutes and then swallowed or spit out. This allows the solution to be absorbed by the tissue under the tongue. OIT-s involves smaller amounts of food protein than OIT. This lowers the risk of dosing-related reactions, but the amount of protection against accidental ingestion may be less than that of OIT. Before considering either OIT-s or OIT, patients and families should be aware of the commitments and risk involved. One of the primary risks of food immunotherapy is causing an allergic reaction. Since a patient will be eating small amounts of their allergen daily, we strongly recommend that at least one epinephrine injector or epinephrine nasal spray is available at all times. You and your provider will review an appropriate care plan in case of an allergic reaction. There are rare but possible complications with OIT, especially involving stomach issues. This can include acid reflux, vomiting, trouble swallowing, and/or stomach pain. To learn more about our food immunotherapy program, visit our website at www.modena-health.com.